Ivermectin is a drug primarily used to fight parasites in animals and in humans. It's gained a lot of interest as a possible treatment for COVID-19 since the summer surge began. The FDA warns large doses are dangerous to humans.
Clinical studies are underway to see if the doctor-prescribed medicine for humans has any effect at all. The KVUE defenders started looking into online claims for those selling ivermectin. And investigative reporter Erica Proffer tells us how they could be illegal and what you need to look for.
Hello.
Conventional is not the way Tom Schnorr operates.
Oh.
He owns a compounding pharmacy. Traditional pharmacies dispense standard manufactured drugs. Schnorr is licensed to mix and tailor the drugs to the patient. Right now, most people want the drug ivermectin. Schnorr says he gets 300 prescriptions a day. His website shows COVID orders. The first 10 items are prescription only. Number 1, ivermectin.
If you treat it when you get infected, you don't have to go to the hospital.
But the National Institutes of Health's treatment guidelines show this isn't the way. The most current guideline is July 8th. It shows there's insufficient evidence for ivermectin to be used for COVID-19. Schnorr disagrees, but adds context.
If you have comorbidities, you probably should vaccinate.
The CDC defines comorbidities as having more than one chronic disease.
If you have comorbidities, you might want to look at lowering your inflammatory response.
So you're not saying that it's a end-all, be-all, cure-all kind of...
There is none.
There is no evidence that ivermectin is beneficial as a treatment or a preventative agent for COVID-19 infection.
Dr. F. Perry Wilson is an associate professor at Yale School of Medicine.
Enter ivermectin.
He leads 2 research teams.
The reason this came up is because there was a really fascinating study in test tubes which showed that if you infected some cells with COVID and then put in ivermectin, the COVID replication was decreased. That's very promising data. But
the catch, what was done in the test tube cannot be done in humans.
So these were not just, mega doses, super mega doses, doses that would be toxic to a human.
Other studies look promising for ivermectin, but experts got concerned. One studied only hospital workers. It's too limited. The study of studies is now pulled.
It's their own paper they've retracted on the basis of this fraudulent study that they included and have recalculated their meta-analysis without that study, finding that there's no benefit of ivermectin.
The Food and Drug Administration investigators looked for people selling products naming COVID-19. FDA sent warning letters to dozens of businesses. They claimed COVID-19 cures or preventions. The FDA shut them down. One warning included ivermectin. It was based outside the United States. It shows the site didn't include needed information like dosage. We showed Schnorr what we found. He said he isn't concerned.
I want to keep you out of the hospital.
The Texas State Board of Pharmacy and the Texas Medical Board issued a joint statement. It reads drugs are permitted to be prescribed off-label, that it's up to professional judgment of each physician and each pharmacist.
To get it wherever we can find it.
Schnorr says many doctors in Austin are not in his corner. They will not prescribe ivermectin to treat or prevent COVID-19.
He didn't offer it at first.
David Kohler said he had to ask his doctor for ivermectin when he got the virus.
That's what the prescription was for 5 days.
Did it immediately, you take it, and then after the first day or second day, you're completely fine, and then you just have to finish it out? Or
No, I started, after around day 2, I started noticing a difference, that in conjunction with the other prescription and the vitamins and everything like that.
Kohler said he was prescribed some of the other items on Schnorr's list too.
How do you know that that's what helped you?
Well, it was that. I also had another prescription in conjunction with the ivermectin, vitamins, sleep, water, fluids. I mean, everything put together, that's when I started feeling better, was after the medical prescriptions from my doctor.
Medical prescriptions. CDC posted this health advisory. People are taking a different version of the drug and getting sick.
I always tell people, I said, if you don't believe me, I mean, even though I can tell you that I took it, call your doctor and ask your medical physician about ivermectin. Don't just go to the pet store or the feed store and buy it.
The FDA issued warnings this year. They were to the public, veterinarians, and retailers. Do not use a horse dewormer. But it's happening in Texas. KVUE defenders obtained information from the Texas Poison Center Network. It showed 195 calls for help last year due to ivermectin. We jumped past that 195 by the end of July 2021. Another 71 people needed help last month. Local hospitals do not track overdoses of ivermectin. FDA allows the human version of ivermectin to be prescribed for off-label use. It is not FDA approved for treating COVID-19. Schnoor goes against government recommendations. He still stands behind his list of meds.
Even if it doesn't work, it's better than doing nothing.
In Austin, I'm Erica Proffer.